Welcome back to our ongoing series where we're delving into the concept of medical assistance in dying in MAID. Today we're going to answer some of your most pressing questions they sent on our video talking about the definitions of MAID. So let's get right into it. Are you ready to truly unlock your potential and supercharge your productivity? Join us on a brand new course we just released on learn.methodologists.org called Optimize Your Productivity, The Secret Ingredients, where we'll help you discover the keys to truly effective work. Throughout this course, you'll learn powerful strategies and skills that foster productivity. Explore our engaging video lessons on passion, metacognition, goal setting, and so much more. Let's redefine productivity, overcome challenges, and celebrate your journey to a more productive and fulfilling work-life journey. Sign up for our course today by clicking on the link below or visiting us at learn.methodologists.org, and I'll see you there. What is the difference between voluntary euthanasia and assisted suicide? Voluntary euthanasia involves a licensed healthcare provider administering a substance that directly causes the patient's death, with the patient's explicit and competent consent. In contrast, assisted suicide is when a licensed provider provides the means or the information for a patient to end their own life, but the patient must take action leading to their death. How does non-voluntary euthanasia differ from involuntary euthanasia? Non-voluntary euthanasia is the act of ending a patient's life without their explicit request. And this happens often when a patient is not competent to make this decision. Involuntary euthanasia, on the other hand, is when euthanasia is performed against the explicit will and desires of an individual in the face of explicit competent consent. So the first one is when there's no consent or consent cannot be obtained, and the second one is against the explicit wishes of the person. Both forms of euthanasia are controversial and widely considered unethical and illegal in many jurisdictions around the world. Is assisted suicide considered legal in Canada? In Canada, assisted suicide can fall under the umbrella of MAID, depending on specific circumstances and the patient's wishes. It's essential to consult Canadian legislation and guidelines to understand the precise legal parameters and conditions under which assisted suicide is permitted. Why is it crucial to differentiate between the various types of assisted death? Differentiating between the types of assisted death is vital because each carries its own ethical, legal, and medical implications. Understanding these distinctions ensures that discussions, decisions, and policies surrounding MAID are informed, accurate, and respectful of individual rights and societal values. How does Canada's stance on MAID compare to other countries? Canada's approach to MAID, encompassing aspects of voluntary euthanasia and assisted death, is progressive, at least compared to many countries in the West. However, regulations, variations, and practices vary widely across the world, with some nations allowing broader interpretations of MAID, while others having more stricter prohibitions. It's essential to understand these international perspectives to better appreciate the global discourse on assisted death. What are the ethical concerns surrounding non-voluntary and involuntary euthanasia? Both non-voluntary and involuntary euthanasia raise significant ethical concerns. The primary issues revolve around consent and the sanctity of life. Performing euthanasia without the explicit request or against an individual's exact will challenges the principle of autonomy, dignity, and respect for individual rights, making them contentious topics in the medical and ethical communities. How do providers approach the topic of assisted death with patients and their families? Providers approach the topic of MAID with sensitivity, empathy, and a commitment to informed consent. They provide comprehensive information about the options, risks, benefits, and implications of assisted death. Open communication, respecting patient autonomy, and ensuring mental and emotional support are all paramount in these discussions. We'll certainly dedicate an entire video talking about the role of healthcare professionals in MAID. So stay tuned and don't forget to subscribe to this channel and stay up to date with the most recently released videos. Are there safeguards in place to ensure the proper application of MAID in Canada? Yes, of course. So Canada has established criteria and safeguards to ensure that MAID is administered ethically and legally. These safeguards aim to protect vulnerable populations, ensure informed consent, and maintain the integrity of the medical profession. For example, and we'll definitely explore this in a future video, requesting MAID at different time points and having a second opinion to confirm whether the request is genuine and appropriate. How do religious beliefs intersect with the various forms of assisted death? Religious beliefs often play a significant role in shaping individual and societal perspectives on assisted death. Many religions have doctrines or teachings regarding the sanctity of life, suffering, and human intervention in death. While some religious groups may oppose forms of assisted death based on these teachings, others offer more nuanced perspectives. It's essential to approach the topic with respect for diverse religious views and understand that personal decisions may be deeply influenced by faith. Are there psychological assessments involved before proceeding with MAID? Yes, so psychological assessments are a crucial part of the process when proceeding with MAID. These assessments ensure that the individual is making an informed, voluntary, and competent decision. They also help to identify any underlying mental health conditions that might influence the person's request, ensuring that the decision is not the result of untreated psychological challenges. How do family members typically cope with a loved one's decision to pursue MAID? Family members' reactions to a loved one's decision to proceed with MAID can vary widely, influenced by personal beliefs, cultural backgrounds, and the nature of the illness. While some may support the decision, understanding it as a choice for autonomy and relief from suffering, others might struggle with acceptance. It's essential to provide emotional support and open communication for families navigating this difficult decision. We will, of course, dedicate an entire video and conversation about families' perspectives with MAID. So stay tuned and subscribe to this channel to stay up to date with the most recent videos. What are the primary reasons individuals might consider MAID? Individuals can consider MAID for various reasons, often deeply personal and multifaceted. Common reasons include unbearable physical or psychological suffering, a desire for autonomy in end-of-life decisions, perceived loss of dignity, or a wish to avoid prolonged suffering. It's crucial to approach each individual's reasons with empathy, understanding, and respect. How do healthcare professionals handle their personal beliefs when they might conflict with MAID practices? Healthcare professionals are trained to prioritize patient care and their autonomy. However, when personal beliefs conflict with MAID practices, professionals might experience moral distress. Many jurisdictions, including Canada, allow healthcare providers to conscientiously object to participating in MAID, provided that they refer the patient requesting MAID to another willing and skilled provider. Continuous education, peer support, and ethical discussions can also help professionals navigate these challenges. What can viewers expect in the upcoming videos in this series? You can anticipate a thorough explanation of all the complexities of MAID, including ethical considerations and the real-life implications of this decision. This series will delve into things like patient stories, healthcare professional perspectives, the legal nuances, the societal impacts, offering a holistic view on the topic. But stay tuned and make sure to subscribe to this channel to stay up to date with our weekly videos where we will be exploring this concept. But that's all I have for this Q&A. Thanks for watching. If you found this Q&A helpful, please let us know by liking, sharing, and subscribing. Until the next Q&A, take care.